This is Piyush Bhargava, and in this short video, I'm going to compare and contrast the radioiodine uptake, retention, and excretion in two patients treated with radioactive iodine. So on the left of the screen, we have an image from a patient's thyroid uptake and scan, which shows enlarged left and right lobes of the thyroid with increased uptake, and we see pyramidal lobe activity, which is suggestive of Graves' disease. Their 24-hour uptake was 90%. So typically this patient would be treated with a 10 millicurie dose of I-131. And after the treatment, since their uptake is 90%, 90% of 10 millicuries would go to their thyroid, which is 9 millicuries. So 9 millicuries will go to their neck or in the thyroid, and 1 millicurie will be excreted in their urine, sweat, and saliva. This 9 millicurie, some of it or most of it will decay in the neck with time, and some of it would be metabolized to thyroid hormones, which then would be metabolized by the liver. Compare and contrast that to our second patient on the right side of the screen who has a history of thyroid cancer and is post-thyroidectomy. The images that we see here are anterior and posterior whole body images from their I-131 scan to look for residual and metastatic disease. So there are two foci of increased uptake in the right side of the neck, which suggests residual thyroid tissue, and their 48-hour uptake was 2%. And typically this patient would be treated with a 100 millicurie dose of I-131. Since their uptake is 2%, 2% of 100 millicuries, which is 2 millicurie, will go to their thyroid tissue in the neck, and rest of it, 98 millicuries, will be excreted in their urine, sweat, and saliva in the first 48 hours. So the difference between these two patients is that the patient with Graves' disease will carry 9 millicuries in their neck 48 hours after treatment, and it will decay with time mostly, as compared to the patient with thyroid cancer whose neck will have close to 2 millicuries, and they will be excreting 98 millicuries in their urine, sweat, and saliva. So typically these patients are given very conservative instructions regarding protecting other people from radiation exposure from their from the radioactive iodine that we have used to treat them, but there is a need to differentiate between these two groups and maybe provide them with separate instructions, because as we saw, patient with thyroid cancer is more radioactive in the first 48 hours. They will excrete 98 millicuries, and then only 2 millicuries will decay in their neck, as opposed to patient with Graves' disease who will carry 9 millicuries in their neck and will excrete only 1 millicurie in their urine, sweat, and saliva in the first 48 hours. Thank you for watching.